Hello, good afternoon. My name is Dr. Tom Baez. I'm the Director of Counseling Services here at UTSA. I'd like to see a show of hands of how many of you have taught before? So how many of you are teaching for the first time? Okay, so it looks like we've got a mix of experiences here. What I'm going to do is I'm going to talk to you a little bit about our services and how you can access them either for yourself or your students. And Diane, as she was talking about this issue, sometimes you will have questions, and the best way to do is give us a call and find that out. Sometimes the students will give you an interpretation of what they understood they heard. That might be different. It's always good to follow up with a phone call to make sure that our communication is clear. What I wanted to show you in the first slide, we have 12 licensed professional psychologists, social workers, or counselors, plus doctoral and master's level students, trainees. These are professional staff. They're trained to listen without judgment, to support and provide guidance, to help you or your students find solutions, to teach you skills that'll help you deal with tough times, whether yourself that you're going through in terms of graduate school or your students, managing feelings, assist us with changing behaviors, and giving encouragement when that's needed. So our staff is available to you and to your students, and I'll describe a little bit more of our services as I go along. What we can do, we can assist students with stress management. These are some issues or topics that sometimes we address with students. They're not all, but these are some. Stress management issues, feelings of depression or sadness, homesickness, adjustment to college, adjustment to a new culture, and relationship problems, that being parents, romantics, relationships, or roommates. Our services are free. No additional cost to you except in the area of testing. I'll talk a little bit more about testing. We do provide some limited testing, for example, for learning disabilities or attention deficit disorders. That is a really small cost to that. Our services are confidential. We do not tell anyone what you tell us except in cases of harm to self or others. And this goes for yourself or students. And we're very clear about that when we meet with you or the students about confidentiality. We're protected by the law of the doctor-patient relationship that allows us to protect that information. But there are exceptions to that in the cases I mentioned in terms of signs or indications of hurting themselves or someone else. We provide individual counseling. We provide group counseling, couples, crisis intervention, on-call and walk-ins, that is, somebody may call in distress and we may talk to them. We have a counselor on duty throughout the day that is available for that. We also have staff on call overnight. And the way to access them is you would contact our UTSA police, and they would contact the counselor to contact you. We provide learning disability testing. We work very closely with the Office of Student Disabilities in helping the students provide the documentation that they may need to get their accommodations. Psychiatric appointments. We do have limited psychiatric services. These are also free and confidential. There are times when students may be referred out, but we have four psychiatric residents. They're each 1 day at the counseling center, and an associate professor from UTL Science, a psychiatrist that supervises that. They do provide prescription, but that prescription we do not pay for. That's up to you or the student in terms of getting that filled. But there are special programs that we might assist you or the student in getting to so that the medication can be accessible to them. We do also provide what's called mental health withdrawals, and I'll talk a little bit more about this because you may find that with one of your students. Mental health withdrawal is when a student, because of a mental health condition, is not able to function academically in the classroom. And the student may decide to withdraw from the course, or may wait and try to get through the class, but at the end of the year may find themselves failing because of a mental health issue. And so what we do is the student provides us with documentation, and we interview the student to determine if in fact a psychological condition impaired their ability to function academically. If so, we would submit a recommendation to the Dean of Students, that being the undergraduate dean or the graduate dean, making a recommendation about a mental health withdrawal. What that will do is that it will change the F the student may get on their transcript to a W. Okay? So that's something that we do and we've done for many years. Sometimes there's a lot of students applying for that. Sometimes the process may take a little bit longer, but the sooner the students get in the information, the documentation, the supports that mental health condition, the faster we can do that. Of course, a lot of times our students will wait till the end of the semester to ask for help. And that's something where you come in that you could be very helpful in noticing when a student may need help and may need to be referred. And I'll talk a little bit more about that in a minute. There's another service that we provide. It's called the Serious Incidents Response Team. And that relates to issues of harm to self or others. And I'll go into a little bit more briefly because I think you may be involved in that. You may need to know how to respond in an event like that. We also provide consultation to students, parents, or other faculty as well through our counselor on duty. That is, throughout the day somebody may call and need a consult, and we'll talk to the counselor on duty. There's one in the morning, there's one in the afternoon, and then there's on call in the evenings. We also offer referrals for students that may need more help than what we can offer. Like I said earlier, we have 12 counselors, we have 4 or 5 practicum students, 2 postdocs, but that might not be enough. There might be a student who needs longer term care, a student that may need to be seen more than once a week, or longer than a couple years. And those individuals will help to get a referral to where they can get the help that they need. So, but we do commit that every student coming in will assess and determine what's the best treatment of choice for them. And if we can provide it, we'll provide it for free. If not, we'll refer out. We do have a really good referral system with the University of Texas Health Science Center, with their long-term treatment center, and they provide long-term psychotherapy and psychiatric services to students. And when they're referred through us, it's a smaller fee for that. Cultural sensitivity. I'm talking about cultural sensitivity because we all come from different cultures and diverse cultures yourselves or your students, and the seeking help might not be part of the culture, or the act of seeing a counselor or psychologist or social worker might not be in their mind frame. So we need to be sensitive to that, but still offer the services and suggest to them that they may be able to seek help this way. That one option is to do this, to see a counselor. We have 5 bilingual staff in Spanish at this point. It's really hard to maintain a diverse staff would represent everyone. It's really difficult and very impossible. We do our best we can to be sensitive to different cultures. Accessing services, there is a number, and it's on the pamphlet that you're getting. 458-4140. If you're on campus, just dial 4140. Students may come in during walking hours, listed on the brochure, stop by our office, or call and set up a time to come and make an appointment. We also have a webpage, and I think that's on my next. Yes. When I want to tell you a little bit about what to expect when a student comes to the counseling center. A lot of times students don't know what to expect when they're coming to see us. They might be a little bit frightened, fearful, anxious to meet with somebody to talk about their personal issues. Sometimes it's really helpful if you can bring the student to our center and say, I'll walk you over, if they're a little bit hesitant or anxious or nervous about doing that. So sometimes, otherwise you can give us a call and say, I'm sending this student, expect this student, blah, blah, and give us some information about the student, and then we'll be ready. But you can let them know what to expect. That they're going to fill out some paperwork everywhere you go for service. You got to be able to identify yourself. They've got to be registered students, so information will be personal, information about themselves, demographics, questionnaires on feelings and behaviors, things that they're going through. They will meet briefly with a counselor to determine their needs, and a scheduled appointment will be set up afterwards, or a referral, depending on what that is. Sometimes it could just be a consultation. The student might say, I just want to consult about somebody or about a friend, and so that individual we wouldn't require that much information for them because it's just a consultation. Like I said before, confidentiality is really important to understand that what they share with us is confidential. It's not going to show up in any transcript. The faculty are not going to know. You're not going to know unless they sign a release that says, I give permission for you to speak to my faculty, professor, or TA. So that's the only time that you would be able to get. It's sometimes hard because sometimes you refer someone and then you can't hear about what happened or how they're getting better or not, or are they going or not. So a lot of times if the student is able to or willing to sign a release that says, I can call your TA, then we could do that. But otherwise, we have to respect the confidentiality of the students. And that's really important because without that, the students would not talk to us. It's really important. And confidentiality is one of the utmost barriers to seeking help as well, because people say, well, if I go and they tell my faculty, maybe they won't want me anymore, or maybe they'll kick me out of school. That ain't happening because we do not release, unless those exceptions of risk to self or others, and I'll talk a little bit more about that in a minute. We're a main campus, a rec wellness center. There's a rec center, there's health, and we're behind health. We're also at a downtown campus, at BV 1.308, further down from the bookstore and the police department had the interest in that building. We're sharing an office suite there with health services. So health services and us are both down there in downtown. You can visit us at our website, utsa.council.edu.council. That's in your brochure. We'll talk a little bit about signs that suggest a need for a referral. You wonder about, I'm noticing this behavior. Is this a sign? Should I talk to the student about getting some help? Some signs include inability to choose courses. Somebody has anxiety about choosing courses. You might say, well, might you want to talk to, they can speak to an academic advisor, or they can speak to a counselor depending on that issue. Unwillingness to take required courses, and they're hesitant. Career indecision. Again, some of those things also could be shared from a career center, that they can have a career advisor as well, a career counselor. But some of those issues, psychologists, counselors are also trained to deal with some of those. Shift work discussion from coursework to personal. When they begin that shift, they're talking more about personal issues, and you think to yourselves, well, I came here to teach, not to help with personal problems, and I don't know what to do with this. That's when you would call the counseling center, or would you refer the student. Interpersonal interactions and dependency in advisor, hanging around all the time and seeking advice. Avoidance of professor or other students. Behavior that regularly interferes with classroom dynamics, with outbursts and stuff. Complaints from peers. Sometimes behavioral stuff could be really difficult to handle in the classroom situation. And you might have to make some decisions about that in terms of, when do you approach a student? Do you approach a student in the middle of the classroom, or do you approach a student, you take a step out of the classroom and talk to the student, or before, or in the office hours, things like that. Complaints from peers. Those are some signs, not to suggest that anything that's in this list you should immediately refer, but think about as those things, and as they begin to accumulate, you kind of more get the sense that maybe they could use some help, or maybe I'll share with them that there's a counseling center that could be helpful to them. The hardest things for us sometimes is for a student to get to the 4th year or senior year and then discover that there's a counseling center. It's just kind of say, well, you've been here 4 years, you didn't know we existed. Academic problems, excessive procrastination, uncharacteristically poor work, inconsistent work, repeated requests for special consideration, excessive absences. Behavioral marked changes in personal hygiene, dramatic weight measures on our webpage at utsa.edu council. And you go with the section where it talks about faculty and staff, and in there is a form that you fill out where you describe what you observe or what you heard about, and you submit that to us. And that starts a formal procedure of making sure that the student seeks help or gets the help that they need. Sometimes the police department, in working with them, we may say, well, could you go check this student out? And they'll go and do a wellness check. Or if the student lives in the community, they'll call the San Antonio police, and the San Antonio police may go do a visit and check to make sure the student is all right. That's a lot of work, by the way. And sometimes we don't always agree of what's imminent risk. The police and we may disagree on that. But we try to review this within 24 hours, trying to make sure that we get the right information and whether the student needs to be hospitalized or not. So those are some of the procedures. In making these decisions, we think about confidentiality, the importance of confidentiality with the student, and treatment, and their right, but also the duty to protect the student from harm to self and others, to protect the UTSA community, including us, you, us. And diversity of personal clinical experience, education, and training. So there's a team that makes a decision about whether this individual should be hospitalized or should be in a SERF process or not. Culture is very important. UTA has their norms, their cultures, and things, and we have to respect that as well in making some of these decisions. So some decisions involve the threat of risk or harm. Sometimes anecdotal information could be helpful to us make the decision. The clinical interview, psychological assessment, determining level of risk, determination of hospitalization or continuity of care. And that's some issues about when a student visits us, and let's say you referred the student, and the student had expressed a concern about harm to self, and may take off the semester and they're coming back the next semester. So we need to make sure that when the students are coming back, that they're ready to be back, right? So sometimes that's why it's sometimes it's a long process of trying to help the student that may or may not need help or may not want help, and then what is our responsibility to institution. So I've kind of give you kind of a broad picture of the counseling services and what we do and about the SERF. And I wonder, are there any questions that you might have? Yes, sir.
What if you notice a student having trouble and you approach them confidentially, hey, what's up, and what do you do at that point if they get kind of upset and really emotional and maybe even very combative or something? You just walk away and you contact y'all?
Well, you could do that. I mean, there's not a one way of doing it, but you would approach the student as you indicated. You ask him, what if I approach a student and he gets more aggressive or combative, right? Well, certainly you don't want to go in there and continue because he could be combative, you could be hurt, or somebody else could get hurt. So you would walk back and maybe wait till the student settles down, or ask him to meet with you after class, or if he walks away, maybe perhaps you could call a counseling center, call the counselor and talk to the counselor and get some recommendations based on what you observed. But yeah, if a student is really upset, you don't want to go in and invade more of the space. You don't want to push it, yeah. But you certainly observe that, and if you think that the student may become violent, then you may contact the police. If you think yourself or your other students could be at harm, certainly the police has ways to come and work with students without being threatening as well. You can suggest to the student, there's a counseling center. Do you want me to walk you down there, or I'll give you the number you can call. I notice you're upset. But certainly you don't want to be invasive if the student really is feeling even a lot more emotional. But certainly you may want to follow up later. If the student leaves and comes back, you might check in with him or and see if he or she may need help. Yeah, there's another hand here.
If you're going to refer somebody, should you tell them you plan on referring them to the counseling services, or
Well, you could and you couldn't. I mean, it's certainly best if you do tell them, because it's better that the student volunteers and say, I didn't know that existed. I don't know if I want to go there. Can you take me? What do I do? And it allows you to do that. It's certainly more advisable to let the student know. Because if you call us and say, I'm worrying about the student, but I haven't told the student, and then if we call the student's going to say, well, who told you? People are talking about me. That's not always advisable when they fear that people are talking about them. We could say, we've had some concerns about you, and I wonder how we can help you. Are you okay? Do you want to come and talk to us? That's another way that we might approach it. But you might call and consult with us about your student. But I think it's more advisable to let them know, I've noticed your behavior. I wonder if, if this might be helpful for you. Check out their webpage, or give them a call, or if you want, I can walk you there. And sometimes you might say, no, I'm fine, and let them go, right? But you might follow up later. Are you okay? So there's not one right answer, but I think it's important, if you do notice something, to address it, to share with the student. I notice this. Are you okay? Do you want me to get you some help, or do you know where you can get help, or and if the student says fine, and then they come back the next day and you still see it, then you might just get in touch with the student or see them in office hours, or some way to kind of allow the student some space, but also to direct them to the choices that they need. Any other questions? Those are really good questions. And yes, sir.
Do you have any tips on how to approach a student without making it appear that you're singling them out or anything?
That you're what?
That you're like, if I say like, okay, can I talk to you after class? Then, that might, it might make them think, it might make them think that.
Yeah. It's a hard thing, because what you're saying is, how do I not single him out, but also call into attention that I want to speak to them?
Can you blackboard them? Because we know our students, and we can't just off to the side, like, hey guys, you want to come see me?
That's a suggestion. Yeah. Well, I mean, recognize that you may see students for many reasons, right? It's not singling them out. I want to see you after class to talk about this issue. And in there you approach, I've noticed this, but this is related to this. Not doing well in this class, and I'm wondering how you're doing. So I mean, people are, you talk to a student about many things other than mental health issues, and nobody's going to know. It's probably best to do it in some kind of privacy, not in front of everyone. But so meeting them after class, or coming in at visit hours might be a way to do it as well. And their questions. I heard that that if you call a student, it's less likely that they'll answer than if you text them. Is that correct? So there's different ways of getting to students in today's world, right? You mentioned Blackboard. That's another option. Well, I do want to let you know that student services, and Diane is here, with disabilities, and there's health services, and there's career services, and we are your collaborators. We're your colleagues, and we're here to. We do feel we have the same mission. We want to help students complete their grades, be successful, and we're part of that. So please count on us, call us, consult with us, and we're here. Our staff are people who want to be in this role. They chose to be in these roles. And so they'll respond because that's what they do. That's what we do. I think that's it, right? Thank you all. Good luck.